Hey, I'm Dr. Susanna Bozzoni, and today we're going to talk about birth control and some little known side effects that maybe we should all be aware of. Actually, we should all be aware of. And that is one, depression, and two, the effects on the gut that can happen as a result of hormonal birth control methods. And now I don't want to underemphasize the importance and the power that birth control has given to women. And so I want you to say, I am not against birth control by any means, but I do think it's super important that we are fully informed of the potential side effects that could arise, especially with the background knowledge that in my training as family medicine physician, I did a lot of women's care. In fact, almost my entire population was women. And seeing as we are not really taught lifestyle medicine and how to address the root drivers of why hormones might be imbalanced in our general medical training, the reflex is to often give hormones, particularly birth control pills, for a myriad of reasons. Anything that might be even adjacent to a hormonal imbalance, such as your periods are heavy, they're painful, your cycles are too long, your cycles are too short, you've got acne, right? And a lot of that we gave and we give to women despite whether or not they need birth control and they need this as a form of birth control. It's because it's one of the few tools in our pockets when we aren't educated in how to address the root drivers of why hormones are going awry. So I say that, again, all of that with best intentions, why we do that, but it's really important that we know the side effects. The side effects beyond that, okay, clotting risk, do you have migraine with aura, do you have liver problems, are you a smoker, some of those basic things if you're of older age or struggle with weight. Well, those are things that most of us usually educate and are aware that there might be increased risk associated with these birth control pills. But I think something that a lot of us are not aware of as medical providers and naturally as women is the increased risk of depression. Yes, depression and gut imbalances related to birth control pills. So I want to talk about that just a little bit so that you are aware. Number one, depression. There was one recent 2023 study of over 260,000 women that showed a 79% higher risk of depression in women within 2 years of taking the birth control pill. And that's really important, particularly because those effects were even higher in adolescent women, ages 15 to 19. And it's really important that other studies, going back to the 70s and 80s, have shown the brain relationship and the direct effect on the brain that these pills seem to have. And of course, that makes sense because there are estrogen and progesterone receptors in the brain. But we see blunted stress response in particularly adolescent women. So women that take these combined oral contraceptives or oral contraceptives in those younger ages might be at higher risk. Not only that, they might be at higher risk for bone issues because it makes it so that the bones are unable to reach their peak maximum bone density, which typically happens around the age of 18 if they're on birth control pills. And so that's just a little side caveat there. And the reason why depression might be related to these pills, well, it's kind of unknown. Number one is, of course, those direct effects on the brain, particularly the prefrontal cortex and memory formation. But another means that this might arise is through the microbiome. So the microbiome we see is clearly affected by birth control means. In fact, it's been shown that women who are genetically predisposed to ulcerative colitis or Crohn's disease, that is inflammatory bowel disease. So if they have this predisposition, they're more than 30% more likely to develop Crohn's or ulcerative colitis in the face of combined oral contraceptives. So that's really important for a number of reasons. Number one, it emphasizes the fact that just because you have the genes that might increase the likelihood of those things doesn't mean you're going to get inflammatory bowel disease. Our genes are not our destiny. The environment creates the ability to turn genes on and off. And it seems that combined oral contraceptives, not progestin only, specifically in inflammatory bowel disease, seems to predispose women to be more likely to have flares or to even come down with the symptoms of inflammatory bowel disease. So that's something really important. And because we know that gut health is so strongly connected to brain health, of course, that's where we get most of our serotonin production, and we really see that direct influence of the gut health on our overall well-being, but particularly on our brain and mood. That's really important. A third piece of why this connection between depression and oral contraceptives might arise is because of nutrient depletion. So again, dating back to the 70s and 80s, we've seen that women that take birth control pills are more likely to be deplete in certain specific nutrients, the B vitamins, B12, B2, B6, also selenium, magnesium, what am I missing? Something, I'll put them here just to make sure I get them all for you. Vitamin C and vitamin E are really important. And now I am not saying to go and pop all of these supplements. What I'm saying is that it's all the more important to recognize we need to focus on the underlying driver. We need to make sure, whether you're on birth control or not, that you are well nourished. And the importance of getting these nutrients in your whole food is so important. And so you might even find that some of the reasons you're prescribed these birth control pills goes away if we address the root drivers, make sure we're nourished, make sure stress management, sleep, and all of these other lifestyle methods should be first-line treatment for all hormonal imbalances. And we can talk more specifically about those. But just, I hope that you find power from this. And you might find power from birth control pills, and that's fantastic. I just want you to make sure that you are well-versed on the potential side effects and that these are not dismissed by your provider because they may or may not be familiar with these. Have a wonderful day. Thank you for your time.